Which of the following compounds is incorrectly matched with its mechanism of action? Options are flutamide, competitively blocks the binding of androgens to their receptor, finasteride inhibits 5-alpha reductase, miglitol inhibits alpha glucosidase, pioglitazone competitively blocks the binding of estrogens to their receptor, anastrozole inhibits aromatase. So here the answer is option D. That is, this pioglitazone does not interact with estrogen receptors. It is an oral anti-diabetic agent that produces its effects by binding to nuclear PPAR, that is peroxisome proliferator activated receptors involved in transcription of insulin responsive genes and in regulation of adipocyte differentiation and lipid metabolism. The other four agents are correctly matched to their mechanisms. A patient on Intinavir antiretroviral therapy begins taking St. John's wort for depression and suffers unexpected reduction in CD4 count. This is most likely due to options are pharmacodynamic interaction producing additive toxicity, pharmacodynamic interaction producing antagonistic therapeutic effect, enzyme induction by St. John's wort causing increased metabolism of ART, then enzyme inhibition by St. John's wort causing toxic levels of ART. ART means antiretroviral therapy. Here the correct answer is option C, that is enzyme induction by St. John's wort causing increased metabolism of ART. The St. John's wort induces CYP3A4 isoenzymes, thereby increasing the metabolism of the intinavir and resulting in low intinavir levels and therapeutic failure of ART. St. John's wort itself has no direct effect on CD4. Which of the following compounds would be most likely to cause hypoglycemia? Options are miglitol, metformin, pioglitazone, sitagliptin, glipizide. Correct answer is option E, that is glipizide. Of all the oral antidiabetics listed, only glipizide, which is a sulfonylurea, directly stimulates the release of insulin to cause hypoglycemia. The other agents are frequently classified as euglycemic agents, that is miglitol, sitagliptin, or insulin sensitizers such as metformin, pioglitazone, that do not frequently cause hypoglycemia. Which of the following substances, when present in urine, is the most likely positive sign of pregnancy? Options are thyroid stimulating hormone, adrenocorticotropic hormone or ACTH, human chorionic gonadotropin or HCG, then interstitial cell stimulating hormone, then isophane insulin. So here the correct answer is option C, that is HCG or human chorionic gonadotropin. HCG is a proteinaceous tropic hormone that is secreted by chorionic tissue, that is, for example, placental tissue. Thus, HCG is present in the urine only after conception has occurred. Which of the following compounds has a mechanism of action most similar to exenatide? Options are insulin, saxagliptin, pramlitinide, repaglinide, metformin. Correct answer is option B, that is saxagliptin. Exenatide is an analog of the incretin GLP-1, whereas saxagliptin is an inhibitor of DPP-4 that is responsible for the metabolism of endogenous GLP-1. Each of the other agents has a mechanism of action that does not directly influence the activity of duration of action of the incretins. So that's all for today. Thank you and have a great day.